Welcome to This Week in Health IT. It's Newsday. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. I ran into someone and they were asking me about my show. They are a new master's in health administration student, and we started having a conversation, and I said, we've recorded about 350 of these shows. And he was shocked. He asked me who I'd spoken with. And I said, just CEOs of Providence and of Jefferson Health and CIOs from Cedars-Sinai, Mayo Clinic, Cleveland Clinic, and just all these phenomenal organizations, all this phenomenal content. And he was just dumbfounded. He's like, I don't know how I'm going to find time to listen to all these episodes. I have so much to learn. And that was such an exciting moment for me to have that conversation with somebody, to realize we have built up such a great amount of content that you can learn from and your team can learn from. And we did the COVID series. We did so many great things, talked to so many brilliant people who are actively working in healthcare, in health IT, addressing the biggest challenges that we have to face. We have all of those out on our website, obviously, and we put a search in there, makes it very easy to find things. All the stuff is curated really well. You can go out onto YouTube as well. You can actually pick out some episodes, share it with your team, have a conversation around those things. So we hope you'll take advantage of our website, take advantage of our YouTube channel as well. Special thanks to Sirius Healthcare, Health Lyrics, and Worldwide Technology, who are our Newsday show sponsors, for investing in our mission to develop the next generation of health IT leaders. We set a goal for our show, and one of those goals for this year is to grow our YouTube followers. We have about 600 plus followers today on our YouTube channel. Why, you might ask? Because not only do we produce this show in video format, but we also produce 4 short video clips from each show that we do. If you subscribe, you'll be notified when they go live. We produce those clips just for you, the busy health IT professional. So go ahead and check that out. We also launched Today in Health IT, a weekday daily show that is on todayinhealthit.com. We look at one story each day and try to keep it to about 10 minutes or less, so it's really digestible. This is a great way for you to stay current. It's a great way for your team to stay current. In fact, if I were a CIO today, I would have all my staff listening to Today in Health IT so we could discuss it. Agree with the content, disagree with the content. It is still a great way to get the conversation started, so check that out as well. All right, here we go. Today, we have it's a Newsday show, and we have a guest host. I used to call you guest, but you're actually a host, a co-host of the show. And you haven't disappointed today. Schade is back in Schade Red, which I really appreciate. Welcome back, Sue.
Good to see you, Bill. Thanks.
Wow, we're going to talk about a lot of stuff. I went to Disney World over the weekend, so we'll talk about that a little bit. I think that's interesting. Plus, every now and then I post something on LinkedIn and it gets a lot of traction. That's gotten 5,000 views in like 36 hours. So I don't know if it's the Disney mystique or whatever, or people just want to know, what does it look like in Disney World right now? And it could be a little both of that. So we'll talk a little bit about that. And I'll tell you how I felt there, and you can tell me how you feel about what they're doing with Advent Health and how they're sort of approaching it. I thought there was some really well thought out and interesting things they did. And I think it could be a precursor to what we see society sort of as we step back, right? As we step into normalcy again, what it might look like and how we could sort of ease into it. You've done a great amount of work on the vaccine distribution. Gosh, two stories now, or three articles you've written?
3. I don't want to say I've done work on it, and I am not on the front lines in any way, but I have been reading a lot and tracking. And yeah, I've written 3 blog posts now about what I call them: vaccine rollout, it takes a village, part 1, 2, 3. So I've covered a lot of stuff. Yeah.
Well, I'll tell you what we could start on, because I cheated. You sent me one of these stories ahead of time, and it was the COVID playbook that the University of Colorado Health System put together. Did you get a chance to go through that? That is really amazing stuff.
It's awesome. And I want it shared widely. Obviously, they're making it available and sharing it. It's a COVID-19 mass vaccination drive-through site, Playbook. It's a comprehensive 59-page document. I skimmed through it, Bill, just to see like what all's there. It's from UC Health, University of Colorado Health in Denver, and they have done at their, whatever their stadium's called there, you might know, you might follow sports. They've done
Coors Field. Yeah.
Of course. So they've done several drive-through weekend events now, and tens of thousands of people are being vaccinated. So it's great. Richard Zane is their Chief Innovation Officer, and he is also their department chair for ED. And I worked with him when I was at Brigham. He was at Brigham during much of the time that I was there as CIO. And I think he's been behind making this happen. And they said they would share their playbook. And I've put it out there because I think organizations that either are going to do that or are doing something similar can still learn from it. And, in healthcare, we're all about best practices and sharing.
Absolutely. In fact, I've gotten some calls from people saying, hey, do you know of anybody who's done this work? And then this showed up, and now everybody who called me, I'm just sending this to them and saying, hey, here it is. I mean, it has, I'm sure you could add to it if you really tried, but they have the organization structure, how it started, pre-event planning. They have it all the way down to the science. They have a page where they said, hey, here's the science that we used.
Yeah.
Across, and it's in English and Spanish across the board. They talk about getting the vaccine there and how you store it on site. There's IT components of it as well. There's standing up a network. Now we've gotten pretty good at this with the testing sites, right? For the most part, in terms of getting networks out there. But they go through it step by step. Okay, are you going to have access to the Coors Field network, and how are you going to ensure that? How are you going to test it ahead of time? And so they have a checklist that they've provided. And the detail of it is phenomenal. They actually have the diagrams of how you bring cars in, how you flow them through, how you have them wait. There's a 15-minute wait period after you get the vaccine, and then how you move them out. And they share some of the stats. I don't have the stats. Well, here are the stats. Let me pull it up real quick. The stats were really impressive. If people are considering this. So they did this 2 6-hour days. Okay. I'm sure there's probably more planning than the actual days, right? That's usually how these things go. 10,000 vaccines were administered, 834 cars per hour, 22.4 minutes per car, including the 15-minute observation period. That's impressive. I mean, they're moving people through 0 unused doses. And that's a huge stat. Because obviously when you take that out, sometimes there's unused doses that aren't refrigerated anymore and you have issues. 0.9% patient no-show rate. Again, that's exceptional. I mean, a 1% patient no-show rate is exceptional. And then all appointments filled within 72 hours. There's clearly demand for this. And is this the kind of thing you only do in a major metro, or do you think we'll see this in some of the more regional or smaller locations?
That is a great question. And again, I think they have phenomenal results. The metrics that you just shared show that. And between you and me, let's get that playbook out there on social media for everybody to take advantage of. Other places that I've heard are doing it are, I think somewhere in Washington State and Oregon, apparently Memorial Hermann in Houston. So that's a huge metro area. They said they had best practice. They were getting calls. Atrium has done this in a partnership with a number of organizations, all drive-through. So, I think large metro areas and maybe, some smaller metro areas as well. The thing, that's a drive-through one, but I would think that much of what they've got there is applicable to mass vaccination sites that aren't drive-through, right? Yeah. So here in New England, at Gillette Stadium, where the Patriots play, Mass General Brigham has partnered with the state and an organization called, oh my gosh, I think it's CIC Health, and I can't tell you what it stands for, to do a mass vaccination site, but it's not a drive-through. Yeah. They are using a huge indoor facility associated with Gillette Stadium. And here in I think in Worcester, Massachusetts, they're using a convention center. Here in Providence, Rhode Island, they're using a convention center. So maybe in the colder temperatures, they're not relying on the drive-through, but park and go into some mass site. But I'm sure that 50%, if not more, of what's in that handbook or playbook could be applied, don't you think?
Yeah, I think that's absolutely the case. Oh, by the way, thank you for sending Tom Brady down here. I now live in Florida, and we really appreciate the Super Bowl championship. That was very kind of you guys, and I just lost all my New England listeners, but it is he is a champion. He wins. It's crazy.
Yeah, I'm not even going to comment on it.
Anyway.
We'll stay away from that. So congratulations on winning. Yeah.
Yeah, that was.
Can we pivot to another? Can we pivot to another story that I had linked to in one of my blog posts? Because I think it ties to what we're talking about with the mass vaccination and the drive-thrus. And that was a story. Well, I first saw it on Rachel Maddow on MSNBC, and then I followed the trail and found the story in the Los Angeles Times. So it's a community center. I think it's Kedren, Kedren, in South Los Angeles, which is largely a Black town area of South Los Angeles. I don't know the geography that well. And the physician lead there recognized the problem of disparities in terms of the vaccine distribution, and they created a walk-in clinic. So if you don't have a car to go to what we've been talking about, you don't have internet access to get online and try to schedule, and you don't have email, what are you going to do? So I just thought that that article was a great example of community-based efforts to address disparities and get vaccines into communities where it is harder to get to them. Unfortunately, I have not seen a lot of other examples of that around the country, but I think it's an emphasis more and more to address those underserved areas.
Yeah, there's a couple things about that. One is part of it is just the availability of the vaccine, and so the health systems and whatnot that have it have limited supply, and they're trying to figure out scheduling and all that other stuff. And so it's one of those that if you're not making a conscious effort, and they should be, but if they're not making a conscious effort to say, hey, what about the people who don't have cars? What about the people who don't have computers? What about the people in our community that are homebound and those kind of things? If you're not bringing that to front and center, that has to be a concerted effort. That's one thing I would say. The second is, and that was with the Sisters of St. Joseph. I was at St. Joe's in Southern California. They would always, every meeting, we'd say, hey, here's how the business is doing. They're like, thank you very much. Let's talk about the community and what we're doing in the community. So I'm sure there are health systems out there that are doing this. I'm not saying that they're not. I'm just saying that it has to be a conscious, somebody has to be bringing it forward. The second thing is, and I'll give this administration kudos on this. I've been talking to a source. I'm not going to reveal my source, but I've been talking to a source who is pretty closely linked to some of the activities that are going on within the government. And this is what they're using FEMA for. They're starting to look at, okay, where can we put these pop-up sites, I guess, to administer the vaccine? At first, I was a little critical of this. I'm like, look, just get the vaccine out to CVS, Walmart, Walgreens, and it'll be out there. But they are specifically targeting some areas where you have these underserved communities. And that is going to be and that's a great way to deploy those resources. But that is also going to be, look, we have, I don't know if you saw the stats. I shared some of the stats. 50% of the population is now in the get me in line. As soon as you can get me in line, get me in line.
Yeah, I heard that.
Yeah. So 20% are still wait and see. Let's make sure that nothing adverse happens. But then there's this 30%. And I've been focused on this 30% for a while yet, because if we can't figure this 30% out, but that's what FEMA is doing. FEMA is saying, all right, in New Jersey, here's a large subsection of the people that are in that 30%, and we're going to go out to them. We're going to be right around the corner. We're going to go out to the homeless. We're going to bring these people in and those kind of things. So again, kudos to the administration for doing that. I don't think it's widespread. I think there's only 4 states that they're looking at right now. I think it's Jersey, New York, Texas, and California, but I'm sure that'll expand.
Yeah. Well, and some states are I think some states started with that focus. West Virginia was for a while the state that had I never know how to describe this, but it's doses in arms as a percentage of doses distributed, right?
Right.
And they were way up in the high 80s, 80%. My state is in the 60s. West Virginia, I've heard the governor on a couple, quick news interviews, and he talked about we had to go to the people, not the people come to us. So they figured out in rural West Virginia how to get it out. I know that in Rhode Island, it's kind of a double-edged sword. To have a really intentional approach and they seem to have sub-stratified a lot of specific groups that should be getting it now, along with 75-year-olds and over. They haven't gone below 75. And it's possible that really intentional approach has also caused them to not have as many doses administered out of what they've been distributed. But let me just, before we leave this point, the big picture, and for everybody frustrated, when's my turn? I want it. They're not the vaccine hesitant, but I want it. When's my turn? How can I get it? The site's open, refresh to get an appointment. You have to take the big picture view and look at how many have been distributed so far, shots in arms, and the fact that the metrics, the key indicators of hospitalizations, new cases, and deaths are going down dramatically. Well, significantly from a very high peak, right?
Yeah.
So it's a good news story on the trend. The numbers are still way too high, but the vaccines are having an impact.
Well, we got exactly what we expected, right? We had Thanksgiving and Christmas, and then the numbers lag, and so towards the end of January, you had peaking numbers because people are just tired of the process, and they're like, no, I want to see my family. I get why they did it, but we also knew the risk, and we saw the numbers go up pretty dramatically. That gets me to another story you shared, which I think is pretty relevant to health IT, and that's delays with Texas coronavirus vaccine reporting system may hinder allocation of doses. Sorry, so actually, let me read a little bit of this. So despite being plagued by reporting issues, data collected in Texas immunization reporting system may soon become a central factor in determining how many COVID-19 vaccine doses the state gets from the federal government moving forward, according to a January 20th Texas Tribune report. And sometimes I don't put too much stock. They're trying to sell newspapers. They make this, because I can't imagine that the federal government's going to say, hey, Texas, your reporting numbers are down. We're going to send all your stuff over to West Virginia. I just don't think that's going to happen. But what they're saying is essentially, look, the reporting we're getting back from the state of Texas through their antiquated system isn't really accounting for all the doses that have been distributed and shots put in arms. And because of that, the algorithm that's used at the federal level is, hey, look, we're looking at this and it looks like you have a ton of inventory still in your state that you haven't administered. So we're not going to send you some stuff, which is understandable. That's how inventory systems work. And so, so health systems, and by the way, this is from the Texas Tribune, and this is a Texas story, but I've heard this from other states as well. The state systems are not as, what's the right word here? Because antiquated is a word I used before, and that's the case in some states. In other states, they're just not sophisticated. They're not, I don't know, we've spent billions literally as health systems on our operational systems in most of our hospitals across the country. We have not spent that at the state level for whatever reason. And so these systems they're sort of buckling under this pressure. So what's a CIO to do in this case?
Well, before I answer that question, when you talk about the state systems, you're talking about the public health infrastructure.
Yep.
And we've not, as a country or states, invested in the public health infrastructure. And I think that also is going to get more attention coming out of this pandemic. And I think that's part of the Biden-Harris administration plan as well, to put more attention there, and probably part of the $1.9 trillion that's being asked for. What are CIOs to do about it? You can't make changes of significance when you're in the middle of it, right? I think that, CIOs working with their executive counterparts in their organizations need to make sure that whatever data reporting is as clean, accurate, and current as possible, going to the right sources that it's supposed to go to. And, probably in the grand scheme of things, participate in some of the advocacy work to improve this in the long run. I don't know if Chime's, all over this in any way or not in terms of their advocacy work and interoperability, but, they may well be, but, you work with what you got and you find ways to affect change in the long run.
Yeah, it's interesting. This is just me being pragmatic here. So I sit back and I go, look, and you have another story in here. You sent over so many stories. This is phenomenal. You talked about Epic has now 100 mass vaccination sites now online. I saw a Cerner stat on that as well, and it's pretty high. But
yeah,
but that's where I'm going. So Cerner, Meditech, Epic, and let's say Athena. You take those, and maybe Allscripts. So let's just take those five. If the federal government would say, look, and I talked to Dale Sanders about this early on in terms of the data. He's like, we're collecting irrelevant data. So this was early on in our field report series, and he's saying, look, they're overburdening the health systems with collecting this irrelevant data. And so they went back and said, all right, this is all the data we need. This is another one of those cases where, look, there's 5 major EHRs, which is going to cover 85% of all health systems who are administering these vaccines at this point. So why don't we just come up with the clear data set that says, hey, here's what you're going to submit, here's what you're going to collect, create those fields within those EHRs, and then have each of those EHR providers generate I mean, at a simple level, a report, but at a future level, just a simple way to query that information to say, hey, this health system we gave this health system this many doses and they've administered this many. And if they want to go deeper into that data, they can. It seems to me like this is not rocket science. We just need, I don't know, coordination around it or effort around it. I don't know. And maybe I'm being too harsh here.
No, I don't think you're being too harsh. And, I'm a pragmatist as well. And, I probably believe more in big government than you do, but it's a time of crisis, which this has been for the past year, right? What has been our national response? What's the partnership between public, private, government? Can some of the work now future coming out of ONC with Mickey Tripathi, who is like all over interoperability, that's his kind of frame of reference and experience. I mean, can there be some partnership, mandates, whatever, with some of those big vendors as to here's what we need. Here's how you have to adapt. If you're collecting this much, you need to collect this much more. I don't know. I certainly don't want to sit and be the Monday morning quarterback with all sorts of, opinions and critiques on what's going on. But, clearly there is so much room for improvement on all those levels.
So you and I are really busy right now. I'm going to transition to the Disney story in a minute, but you and I are pretty busy right now with our roles in supporting CIOs, supporting health systems, and those kind of things. Yeah. What are the kind of things you're hearing right now? What's going on in the field?
That's a great question. I'm super busy this week with a particular client that's got a big go live April 1st. And we're doing what we call independent verification and validation review. So I'm kind of heads down right now this week with that client as to where they are at. In the bigger scheme of things, for all the people that I'm talking to, I think that CIOs starting to pivot to some of their back burner projects as they look at their 21 agenda. But I would say in the last 2 months, most people that I've talked to, it's vaccine, 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 and being flexible, change on a dime. We're gonna stand up another mass site. We're gonna stand up another clinic. We got to get to our employees. So pivoting back to the vaccine. And one of the things that they're dealing with is that variation on number of doses that are even available. So how do you know you have to be ready with everything to stand up a clinic on Monday if you haven't been confirmed that you've got the doses?
Right.
So more and more CIOs are just talking about the flexibility needed right now in their roles.
Yeah, one of the things you said there, and you're talking about a go live. One of the things I'm hearing is in addition to, just the words in addition to. It's like, yes, we have to do all this COVID stuff, but we have to kick off all these back burner things that have been out there. And I'm like, all right, so what's come off your plate? It's like, no,
Nothing.
and
Yeah. What? Yeah. What are you hearing?
Well, that's what I'm hearing. I mean, it's in addition to. It's like, yes, we now all of a sudden have to become experts on getting the vaccine out to our entire community, which actually is there's a lot of aspects of that are a new muscle. It's outreach driven. It's to the entire community. It's not just to your patients. So you can't rely just on your EHR database for outreach. You have to think, okay, well, we were talking about earlier, what about the people who aren't in your database, the people in your community who might go unreported or underreported? I know if I were still the CIO at St. Joe's, we had about 12% of our ER visits every year in Southern California had incorrect or no social security numbers. And you could read into that whatever you want to read into that. But essentially, these are people who did not want to be known in the system. So doing outreach to those people would require some very creative partnerships with whoever, with marketing for sure, but potentially with local community organizations and whatnot to find these people and to make them aware of what's available to them. So, but I am hearing, in addition to, we have new skills we need to learn and stand up, but it's, hey, look, we've got to get back on foundation, back on our build, back on our up-to-date schedule. Oh, by the way, cybersecurity, it has not gone away. And in fact, it's quite the opposite. It's elevated in terms of its visibility at the board level. I mean, so those are just some of the things I'm hearing. And it kind of surprises me because I thought there would be, one of the things that was great about the silver lining in COVID was focus, right?
Yeah.
There was a day that everybody came in and said, this is what's most important. And it feels almost like we're snapping back and saying, hey, everything's important again. And I don't know if we're going to be able to move at the pace we did last year if we just throw everything back and say everything's a high priority item.
Yeah. Can we pivot to the story that I sent you about, where is it? It's the one about CEOs not getting distracted, right? Can we pivot to that?
It seems appropriate, sure.
Yeah, I have it here. I print too much, so I've got some paper, I got some stuff, pulled up on my monitor.
So this is a Becker's article. It's "Don't Get Distracted" and other health exec advice on vaccine rollout. So sandbag, Susan Casey, who would you like to highlight here?
Sure, a couple people. So I think that Susan Casey, Chief Quality Officer, physician, interim Chief Quality Officer at University of Illinois Hospitals and Clinics in Chicago. She said the best advice is don't get distracted. And this really does tie into what's going on for health systems right now. And this is about, obviously, the vaccine. Overall goal of our program has been to get vaccine out quickly and safely. There have been several points along the way where there is discussion and debate about priorities and order of offering. We found that if we focus on the broad categories outlined by CDC, Chicago Department of Health, we can quickly offer vaccine to many people. If we're not distracted by debate, we can focus on operations that allow us to move quickly through tiers and phases, offer more vaccine. Every vaccine delivered has an opportunity to help us fight the pandemic. So that's focus, get past the debate and discussion, right? And just get it done. Some of the other ones just talked about their core operating principles in terms of the work they do every day, apply that to the vaccine. So you and I have both been in a number of organizations, and health systems and IT leaders and their teams can have way too many priorities, way too much discussion for way too long about getting something done. And, I've heard COVID speed in the last year. I hope that that continues. COVID speed, COVID focus. Let's not get bogged down in some of the debates and, focus on getting things done. So I don't know. I may be rambling,
No, no,
Bill,
actually,
but I think that was the right pivot from what we were talking about in terms of everything they've got on their plate. And in addition to, it's kind of like back to core business on how to deliver, which health systems do. There are times of crisis. They're there every day for people.
yep, I agree. You want to hear about my trip to Disney World?
Well, I listened to
Oh,
it.
you listened to it. Well, anyway, for those who haven't listened to it, it's obviously I'm doing the Today Show, and I did share this. I'll just give you some of the details. We were actually a little nervous going up, and my wife and I talked about it. Like, if we saw certain things, we were like, all right, we're out of here. Now, Disney's a really well-run organization. They even we can argue, is Florida doing the right thing or whatever? But regardless, Disney as a microcosm within Florida, you would expect it to be top notch, and they really didn't disappoint. I was really surprised. I thought, I've been here many times. We went there on our honeymoon. That's one of the reasons we went back. Was anyway, it's her father died over the holidays, and we decided, all right, we're going to take a trip. And actually, we had planned this before because she was a caregiver and she was giving so much of her time. I'm like, all right, you need a break. And so this is what we were going to do. And so we talked about some of the things. We said, if they're not going to be stringent with people wearing masks, and people are just going to be walking around willy-nilly without their masks on, then there's a little too much risk there. We'll look at that and determine whether we feel comfortable there. There are a couple places in Florida that we have visited and have gone, you know what, I'm going to wait until this pandemic's over before we go back to that place, because that's not safe. And I have my friends who are like, oh, you're overreacting. I'm like, no, I'm not overreacting. I mean, I don't need to go to that store. I don't need to go to that restaurant. There are other restaurants that are acting appropriately. So I'm just going to go there. And I understand if you want to do your protest movement by shopping at that store where you don't have to wear your mask, then, have at it and do what you do. That's fine. It's a free country. But this is how my wife and I were approaching it. And when we went there, we were surprised. You're talking little kids. You're talking 3 and 4-year-olds that had their masks on. I thought, oh, clearly the kids are going to be taking their masks on. And they weren't. And that was fascinating to me. The other thing is, as you would think, I mean, the signs are clear when you're coming into the park. You get this stuff ahead of time. You're going to be wearing masks your whole time. They tell you how to wear the mask snugly over your mouth, over your nose. They repeat it about 1 million times. On every ride, you hear it. When you're, walking around, things will come up. I did think the interesting thing to me was they looked at some events and they said, you know what, we can't control the crowds. And you think about it, it's like, well, Disney always controls the crowds. It's like, no, there's events like the fireworks. And the fireworks I was disappointed not to have the fireworks. It's one of the things that makes Disney magical, right? You stand in front of the castle, you see the fireworks over there, and they've gotten so good at it over the years. And they just said, look, if we do anything that causes people to just congregate, they're going to congregate. So they did away with that. They did away with parades. They did away with a lot of shows. They used to have like freestanding shows and that kind of stuff. And they just said, look, we're not going to take that risk. So when my wife and I, after the first day, we sort of looked at each other and said, no, I feel very safe here. They installed the plastic guards and those kind of things. So you listen to the show, sort of describing some of the things. They took the monorail. The monorail to me also was very interesting because public transportation essentially within Disney World. And when you get on, they've created compartments. And so, there's a thing for 2, a thing for 4. I don't know that you can do this in the New York City subway, but I can't imagine going on the New York City subway and feeling safe. Can you? I don't know how that would function. So you heard all these things. How does this sort of translate? Let's fast forward and say we get to 50% of the population vaccinated, about 20%, 10 to 20% have had the virus itself. We get to these numbers where it's like, okay, we're bordering on it's safe again, but we just don't know who has it. What is this going to look like? How are we going to step back into society?
You know, fascinating conversation. And I did listen with great interest. And I can see, I think before we started recording, did you say that it's had 5,000 downloads already?
Yeah, 5,000 views.
Yeah.
Yeah.
So is that people who are like, oh my God, I want to go on vacation. That's what it's going to be like. I was thinking of Disney. I've heard Disney is safe or what, but I think we're all starting to think about after. My husband and I over dinner last night talked about a vacation that we had to cancel and now we've bumped out, and we talked about what that might look like, how safe, and January 22 and what we might need to be concerned about. It's going to be different. Your description of Disney was different. I love the fireworks as well. The parades are great. The characters, you didn't mention that, but you talked about how the characters were not where kids could run to and congregate and take pictures, but they were on a balcony or they were over here and you could see them, but not that congregating. So there was a part of me that's like, okay, good, they did a good job, and also sad. It's like, okay, that's a different experience now. And what will things be like in the future? But we're all adjusting to the new. And I mean, you did a great job describing it and posing some of that, the 2 points you made at the end, because you do the so what?
Yeah.
The health, what's the health system that is connected to them?
Advent Health.
Advent Health. That, here's another revenue source for health systems as they look at how do they work with organizations in their community. And I think your other so what was around digital health and the digital experience, and how good Disney is at that, and how we need to be good at that within healthcare. So, and those are my takeaways as I listened to it.
Yeah, there was no.
And let me tell you this: the first vacation that we canceled in 2020 was to Disney. We were supposed to go to Disney at the end of April with my daughter, son-in-law, and 2 of the 4 grandchildren that have never been to Disney. So when you describe the experience, it's like, okay, that'll be the experience when we do get to go, I guess.
Yeah, so 2 things on that. One is we drove. I haven't been on a plane since February of last year.
Yeah, me neither.
And I'm not that my daughter has. She went back to school on a plane, and my wife has been on a plane, and they describe it, and it was different. So my daughter was on a plane back when their seats in the middle were empty. By the time my wife went on a plane, she said the plane was packed from front to back, and I'm like, I don't know how I feel about it. So we drove, so I felt relatively safe there. The other thing is, at one point, my wife looked at me and said, "Do you think they'll ever bring the fireworks back and the parades back?" I'm like, "Yes, I do think they will bring them back."
I think so. Yeah.
And they're just looking for the appropriate time, the appropriate, all those things. So, and the other question she asked me is, "Do you think we'll wear masks forever?" I'm like, "Some people will." I think we will see. You saw this in Asia, right? If you went over to Asia, if you went to Japan, you went to, you would see this. And somewhat in China, it's about the air quality because there's such a coal producing kind of place. But in Japan, it's relatively, it's relatively common to see people with masks on as well. And I think we will see more people who just as a daily course will wear masks, even if you fast forward 2 years from today. Yeah. Everyone's vaccinated. Maybe we're beyond this. We'll see that. I understand the argument. I mean, we've had no flu season to speak of. Wouldn't that be interesting to really take a huge dent out of the flu season every year? But I'll be honest with you. I'm not willing to give up, and this sounds kind of harsh, but I'm not willing to give up Disney fireworks and parades 2 years from now for for a 2% chance that I'm going to get the flu, or a 5% chance. And we could argue that. And I think, to be honest with you, we need to have this discussion, not today. Everyone should be wearing their mask today. I get that.
Absolutely. Yeah.
But at some point, there's going to be this conversation of, okay, everyone sort of gets to make a decision. I don't know if that's a year from now. I don't know if that's 2 years from now. I don't know when it is, but I want us to be able to have those conversations without ostracizing the other side for, whatever.
Yeah, it's, masks became politicized. COVID was downplayed, and here we are. And now we're trying to get through it. what life looks like when we are through this. We're not sure, but it will be different. And many of those things will come back. Many of those things will come back, slightly changed. So
let's talk
trying
about,
to be optimistic.
let's close this out on an IT note. And that is the digital experience at Disney was exceptional. So again, one of the things I said is hardly any contact transactions happen. Even the front desk, I checked in to our hotel before we arrived. And so when I arrived, they essentially had stuff. Now somebody handed me some things, but it was like, I checked in, they handed me things. I went to my room. They gave you the option of somebody coming in and cleaning your room every day or not, which they usually do, but this was more pronounced in terms of, do you want this or not? In-room dining was interesting. The restaurant was at half capacity because it was only indoor dining. So they cut down the capacity pretty significantly. So it's about half. But then what they opened up was indoor dining where you would call. Now, when they came up for indoor dining, you didn't get plates and silverware and all that stuff. They brought it to you it was like a Uber Eats kind of thing. So here's your food. But the reason I bring this up is I spent a lot of time on my phone while I was down there, and every transaction I can think of was on the phone, communicating, ordering food. I think we've gotten used to that in our home world, that we order Uber, we order food and that kind of stuff. But we sort of step back into some of these things when we go into healthcare. Here's your clipboard. And you're like, really the clipboard be gone thing has to be almost like the fax. It's like, let's get that. If you see a clipboard somewhere if you see a patient with a clipboard, it's somewhere within your health system, that is an opportunity for digital and needs to be addressed. And I'm sure there's a handful of others that I'm not even thinking about at this point.
I think the point on that is Disney was already very much there,
right,
in terms of their digital and their consumer experience, their customer experience. So they probably didn't have to take it up that many notches for what you're describing.
Right.
So the healthcare systems that have been ahead of the game in terms of digital and are in a position to take it up those few notches pretty quickly. The ones that haven't been thinking about this yet and are not there have a long way to go. And I think it's a focus that we're going to see. You asked about, what am I hearing? I'm hearing from a lot of people. They're trying to figure out their digital health strategy, their digital front door and beyond. So it is a definite focus that has been probably gotten more executive level attention too. Great. In the past year, in terms of the need and the importance.
Well, Sue, every 6 weeks, you and I are going to get together on this show. We're going to talk about things. So, and it feels like,
excellent.
It still feels like 6 weeks might as well be 6 months. It feels like so much happens between each time we get together. Yes. So who knows, what we'll be talking about the next time around. Thanks again for your time. I really appreciate it.
All right. Well, thank you.
All right, that's all for this week. If you know of someone that might benefit from our channel, please forward them a note. They can subscribe on our website, thisweekhealth.com, or wherever you listen to podcasts. Apple, Google, Overcast, Spotify, Stitcher, probably some other places that I'm not even familiar with. We want to thank our channel sponsors who are investing in our vision to develop the next generation of health IT leaders: VMware, Hillrom, StarBridge Advisors, Aruba Networks, and McAfee. Thanks for listening. That's all for now.